Welcome back to Chapter 17. This is part number 2. In this particular presentation, we are going to go ahead and take a look at the hormones of the posterior pituitary gland, the pineal gland, the thymus, the thyroid, and we're also going to make our way down and take a look at the pancreas and what's happening with those gonads. Alrighty, so last we spoke, what we were discussing is the fact that the hypothalamus has full control over what's happening in the pituitary glands, both the anterior and the posterior. And one thing that I pointed out was that the posterior pituitary gland is composed of the same embryonic tissue that the hypothalamus is, so we're thinking neurons and glial cells. This means that in order to communicate between the hypothalamus and the posterior pituitary gland, we do not need to use a bloodstream or a portal system. Instead, we're going to be using a tract system, which allows for the hormones from the hypothalamus to slide down into the posterior pituitary gland. Also remind yourself that the posterior pituitary gland does not produce any hormones. It will simply store and release the hormones that it receives from the hypothalamus. And these two hormones will be your antidiuretic hormone and your oxytocin. Your antidiuretic hormone, when it comes to its function, you want to be able to explain that it's going to allow your body to hold on to more water, and this will be excellent in preventing dehydration, and obviously it will lower your urine output. So as you can see in the name, it says antidiuretic hormone, ADH, and a diuretic usually indicates a release of water. So if you've ever gone to the pharmacy and maybe bought an over-the-counter diuretic, what you're going to notice is that you're going to be peeing a lot more because it's an excellent way to get rid of excess water. Some people will purchase it whenever they feel bloated. So an antidiuretic will cause you to hold on to that water. And in order to do that, we are going to have to reduce our urine output. And what we also see happening is that your blood vessels will have a tendency to do vasoconstriction. Vaso for the blood, and constriction means that we're going to narrow the diameter of the blood vessel, thereby reducing the amount of blood that flows through your blood vessels, aka the amount of plasma, which is going to correlate with how much water we're able to maintain within the tissues themselves. When it comes to oxytocin, I want you to think love. Oxytocin is the love hormone. It is the cuddle hormone. Both male and females enjoy this hormone quite a bit. It is often discussed when you take a look at the sensation of sexual arousal. We know that we release it whenever we orgasm. If you look at someone that you're in love with and you get that feeling of butterflies in your stomach, that is all due to the fact that your brain is releasing oxytocin. If you guys have a dog at home, then you know that regardless of how bad your day is out there, when you get home, that dog will run to you and it will look at you like you're the best thing they've ever seen. Well, they did a study, and it turns out when your dog is looking at you so lovely with its beautiful eyes, it's actually releasing oxytocin. So your dog is literally in love with you. How sweet is that? We also know that oxytocin will encourage emotional bonding, and oftentimes you'll discuss oxytocin because it's an important factor during childbirth. Whenever the baby is ready and it's time to start pushing, what we see happening is that the head of the baby will start pressing down on the uterus, and as it's pressing down on the uterus, it causes the brain to release oxytocin. Oxytocin will travel down and it will go ahead and cause the uterus muscles to start contracting. And the more it contracts, the more oxytocin you release, and eventually there is so much oxytocin floating around in the body of the pregnant woman that she's able to dilate enough for the baby to gently slide out. Let's call it that. Now, once the baby is removed, the oxytocin is still circulating in the bloodstream, and it will now circle over to its function of emotional bonding, which we see will continue to increase the more you have skin-to-skin contact, as well as long as you are lactating and breastfeeding your child. So on the little PowerPoint, I added a little picture with the baby lying on mom, making skin-to-skin contact. And what we're seeing now in a lot of hospitals is that they're actually encouraging this because we know that whenever you're touching skin-to-skin, it releases oxytocin, and that, of course, allows us to form an emotional bond. Skin-to-skin contact is not only limited to biological mothers, they will encourage fathers to do skin-to-skin contact, but also in the case of that if there's like an adoption or if there's a surrogate, the parents that will be raising the child will do skin-to-skin contact, and it seems to help with the emotional bonding. All right, now before we move on to other pituitary glands, let's go ahead and take a look at exactly how the pituitary secretions are controlled. A lot of them will rely on what we call negative feedback. And negative feedback basically means that the body will send out a stimulus and the hormones will go ahead and start being produced and get released. As soon as the hormones will interact with the target cells, what we see happening is that the stimulus will then disappear. So basically in a negative feedback system, it's sort of an on-demand system. As soon as you have your product, the stimulus goes away. And this is important because it's going to allow you to minimize the amount of time and energy that the body will spend on this particular stimulation. So let's run through a scenario, for instance, and this will correlate with the picture that you're seeing on the right-hand side. So in a little bit, we'll talk about the fact that your thyroid is important because it helps with your metabolics, and it also indirectly generates body heat, which we can use to regulate our body temperature. So let's say that we're going to go on vacation, and let's go somewhere where it's really cold. So maybe like Aspen, right? Because we've always wanted to ski and snowboard. So we're going to go ahead and hop on a plane. I think ticket prices are very cheap right now. Ha 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 ha. Anyway, so we're going to hop on our plane. We're going to get to Aspen. And when we get there, we're going to notice that we're super cold. We're going to start shivering. And our hypothalamus will also notice this. And it will go ahead and respond by generating more body heat for us so that we can literally warm ourselves, and it will also adjust our body temperature so we can get used to this cold temperature. So your hypothalamus will notice the stimulation, and it will go ahead and it will communicate with your anterior pituitary gland. So this is represented by the green arrow labeled number 1. The anterior pituitary gland will respond by the arrow labeled number 2, and it will release thyroid stimulating hormone. This hormone, as we talked about, travels over to the thyroid, and now we get to arrow number 3, where it will release thyroid hormone. And thyroid hormone will travel over to number 4 and will interact with the target organs. It will increase your metabolism, it will generate more body heat, and the minute it starts interacting with the target organs, what we see happening is that we start looking at arrow number 5 and 6. And notice how they're indicated in red because they're going to have an inhibitory effect. And they're going to be communicating with both the hypothalamus and the anterior pituitary gland that the mission is complete. So please stop secreting your hormones because we don't need any additional. And this is therefore an example of a negative feedback system because the minute you get to the target cells and the target organs, you shut down the stimulatory or the hormone producing sections of this particular axis. Now, there's also a positive feedback system, and a positive feedback system is what we call an amplifying system, and the way that would differ is you would still go ahead and receive a stimulus, you would release the hormone would travel over to the target organs, and then where it varies is that once it reaches the target organs, instead of having red arrows or inhibitory actions, you would actually have green arrows and more stimulatory effects. You would actually amplify the response. And a really good example is what we were just chit-chatting about with oxytocin. When the body goes into labor, the mom will release oxytocin. It will travel over to the uterus, and the uterus will cause the muscles to contract. Now, one muscle contraction is not enough to get the baby out. So what we see happening is as soon as the muscles contract, it sends a signal over to the hypothalamus and the posterior pituitary gland to release even more oxytocin. And the more oxytocin you release, the more the organs react by contracting, and the more they contract, the more they send that amplifying signal over to the hypothalamus and the posterior pituitary gland for even more oxytocin. So it's a cascading, self-amplifying cycle. This one takes a lot of energy and it takes a lot of time because you're consistently stimulating the entire axis. So at the bottom, I proposed a question and I said, is there a preference? And the answer is yes. Your body would prefer to do a negative feedback system and simply work on demand. It will do a positive feedback system though, but often it will be in life-altering or life-saving scenarios. So things like childbirth or in like the clotting mechanism that we see when platelets get activated. Alrighty, so let's take a look at our next pituitary gland, our next endocrine gland, and that is going to be the pineal gland. Whenever you come across the pineal gland, from an anatomical standpoint, we're looking at the back of your thalamus. So you can see in the little insert, I've indicated it for you, a little red pineal gland sits over there. A unique feature of the pineal gland is that it undergoes what we call involution, which means that it will actually shrink as we age. And in fact, by the time we're adults, it's nothing but just like a little shrunken mass. And in a lot of autopsies of the elderly, what we see happening is that it's nothing but just a little bit of adipose tissue, very hard to distinguish from the rest of the brain. So what do we need the pineal gland for? Well, we're going to think about serotonin and we're going to think about melatonin. Those are the two main hormones that you discuss with the pineal gland. And we see that serotonin is usually at its height whenever we are active. So for many people, that will be during the day when we are getting up, getting ourselves ready, getting our kids ready, going off to work, doing our day-to-day routine, keeping up with the shopping, the gym. Oh, who's going to the gym? Anyways, we're doing our day-to-day stuff. We see that our body is filled with serotonin because it keeps us nice and active. And then when it's nighttime and it's time to kind of relax and calm down and go to sleep, what we see happening is that we will get rid of the serotonin and we will then start relying on melatonin. Melatonin has a very calming effect. In fact, if you've ever had issues with like jet lag, you maybe traveled out of a different coast and I have a really hard time kind of falling asleep with the new time sense, they might suggest you to go get some melatonin tablets because it's supposed to increase your sleep sensation. Research is still out on that. But either way, serotonin is when I'm nice and active, and melatonin is when I tend to relax and sleep. Now, because for many of us, that means that serotonin will be high during the day and melatonin will be low at night, we can go ahead and say that it helps us with our circadian rhythm. Our circadian rhythm is how our body functions during times of daylight and times of darkness. We see that when it's daytime, our body usually associates that with serotonin, and when it's nighttime, we see that the body will associate that with melatonin. Now, it's just something to kind of bring up. If you're someone who works overnight and tends to sleep during the day, we do see that your melatonin and your serotonin levels will fluctuate to whenever time periods you're the most active versus when you are sleeping. So we don't always have to rely on the sun to indicate our body that it's daytime and darkness. But we do know that the sun's ray and exposure to daylight plays a role in serotonin production. We also have seen studies that the pineal gland and its secretions will actually also assist us with the timing of puberty. We also see that in different animal models, it will correspond to when the animals will have their breeding cycle and their sexually mature date. So we know there are some links to that. But the main purpose of the pineal glands, for sakes of our discussion, will be for the circadian rhythm. And I want to point something out to you. So they did this study where they saw that if you live in areas that have fluctuating seasons where, the amount of daylight you're exposed to will significantly decrease during certain parts of the year, there seems to be an increase of this disorder called SAD, SAD. It's called seasonal affective disorder. And usually what that's associated with is that people are in areas where they don't have a lot of daylight, and the nighttime or the darkness will start to increase as you go towards the climates or towards the winter season. Now, what are the symptoms of this? Well, we see that usually patients will come in and they'll say that they have a really hard time staying awake. They'll be very lethargic. They tend to be very depressed. They also have a lot of cravings for carbs, so we see weight gain tends to be an issue with this. And on the PowerPoint, I actually wrote down that a lot of these symptoms are very similar to PMS, premenstrual syndrome. And I'm bringing this up because it turns out that since the symptoms are the same, we can go ahead and often treat them the same way, and that is increased amount of daylight that the patient is exposed to. So what if you live in an area where you don't have a lot of daylight, but you're still having to suffer from seasonal affective disorder? Well, that is where our phototherapy comes in. So on the PowerPoint, I have included two illustrations, and notice how I did not discriminate between the sexes, because it doesn't only affect women, it also affects men. And you can see that they're sitting next to a phototherapy light, and it basically meant to stimulate the sunlight. And usually based on your symptoms, you will then get a little therapy treatment that will indicate how many hours you should be exposed to it. And research has been very promising, and it does show that this phototherapy is effective in kind of tricking the body that it's daytime and that you want to be active, and thereby it increases your serotonin levels. And as the serotonin levels increase, we see that a lot of the symptoms will start to diminish. All right, the next one is your thymus. Now, your thymus will also undergo involution. Remember, that means shrinking. So you have your pineal gland and you have the thymus that will undergo involution. Your thymus sits a little bit above the heart, right below the thyroid. So go ahead and take a look at the picture that's at the bottom of the slide, and you could see the newborn and you could see the adult. So you could see your thymus labeled, and notice how much larger it is in children than it is in adults. And it turns out that your thymus, as you age, starts to shrink, so it has that involution. And the reason we need our thymus is because it's going to be secreting hormones that are related to maturing our T cells. T cells are a specialized white blood cell that will be very important for our adaptive immune system. Now, I want to kind of step away from the thymus and not go into great detail, because we're going to do an immune system chapter that will discuss the thymus in great detail. So for now, we're just going to associate the thymus with the hormones that are needed to mature your T cells, which are your white blood cells. And please know that that the thymus does go through involution, so it shrinks as you age. And to kind of match up the questions just a little bit, it says, what happens if the thymus malfunctions in children? Well, it turns out that we need an enlarged thymus as a newborn and a child, because you're basically born with a blank immune system. So the thymus will help us get to know our different foreign antigens and develop a defense system. So if children have a malfunctioning thymus, usually it ends up that they're immunocompromised, meaning that they're not able to have an effective immune system, which could actually be detrimental not only to their quality of life, but to their life itself. Don't adults still need a thymus? Well, yes and no. We still need a thymus because we're always exposed to foreign antigens, so we definitely need to continue maturing and making our T cells immunocompetent. But it turns out that as we go through life, the one thing that we see happening with the T cells is that they're able to remember the antigens you were exposed to, and they're able to sort of adjust. So as you grow older, the need for the thymus starts to diminish, because your T cells in essence start forming their own quote-unquote library of immune cells. So it's okay for the thymus to shrink as we age, because the T cells will start stockpiling and your immune system will have a memory and become very robust. So that is just a little FYI about the thymus. All right. Now let's move on to the thyroid gland. So the thyroid gland is going to be an important one. It is the largest gland that we have in our body that is only dedicated to the endocrine system. It is composed usually of two lobes, and it has a little connection, a little isthmus that sits below the larynx. That's your voice box. And what we see happening from an histology point of view is that it's full of thyroid follicles. And these follicles will have couloid inside of it, which is this protein-rich component, and it will be surrounded by what we call our follicular cells. And over there, we will find that the thyroid hormone will produce, our thyroid glands will produce thyroid hormone. And thyroid hormone is dependent on iodine to be fully functioning. So it comes in two variations. It comes in T4 because it has 4 iodine atoms, and it comes in T3 because it comes with 3 iodine atoms. Now, for our exam, we're just going to call it thyroid hormone because later on when we take a look at our metabolism, we'll go into more detail about the differences between T3 and T4. So for now, just know that the thyroid gland has the thyroid follicles with the couloid inside, and the follicular cells that surround the follicle will help us secrete thyroid hormone, and the effects of thyroid hormone are very fast, but they're mostly surrounding our metabolic rate. Your thyroid hormone will increase your metabolic rate, and as you are digesting your food, we see that it also causes a consumption of oxygen. As a byproduct, you will generate heat that will be released. So we like to call it a calorogenic effect because that's how you burn your calories. Your thyroid hormone will also play a role in the release of your growth hormone. It will also play a role in how alert you are, and we also see that it plays a role in our appetite. Now, in addition to your thyroid hormone, your thyroid gland will also have what we call calcitonin. Calcitonin is a hormone that's released by the parafollicular cells. These are cells that are outside of the follicle. When they release calcitonin, it will cause your blood calcium levels to decrease. So on your PowerPoint, it says, parafollicular cells secrete calcitonin with rising blood calcium. So whenever they detect that you have too much calcium in your bloodstream, the parafollicular cells will release calcitonin, and they'll try to lower that blood calcium. And the best way to do that is to take the calcium out of the bloodstream and put it into your bones. So in order to do that, they're going to have to start building some bones. And so they're going to increase your osteoblast activity. So here is our thyroid, and as you can see, it's wrapped around the trachea, very close to the thyroid cartilage that's associated with the larynx. And for those of us who are going, what's my larynx again? It's your voice box. So what you can do is you can take your fingers and put it on your throat, and the part that's vibrating, that, when you're talking obviously, that is going to be your larynx. Here is the thyroid gland from a histology point of view. So go ahead and take a look at the part that's labeled a follicle. So notice how they bracketed the circles. And inside the follicle, you're going to go ahead and see your couloid. And then notice how surrounding the follicles, you're going to have the follicular cells. Those are the ones that are going to give rise to our thyroid hormone, T3 and T4. And then your parafollicular cells are cells that are outside of the follicles. They do not form part of the perimeter of your follicle. They are just sequestered by themselves. Those are going to be responsible for calcitonin production. All right. Now, if you take your thyroid and you kind of flip it over and take a look at the back of it, the posterior end, you're going to notice that you have these 4 glands that are embedded in it. Those are your parathyroid glands. And some people have more than 4, some have less, so that 4 is kind of like an average number. But either way, we see that they're embedded in the back of the thyroid, and they are going to go ahead and help us secrete parathyroid hormone, also known as calcitriol. Haha, don't get it confused with calcitonin. It's going to be calcitriol. Now, your parathyroid hormone is going to be an antagonist to calcitonin. So just to kind of refresh your memory, calcitonin came from the parafollicular cells in the thyroid. Your parathyroid hormone, or calcitriol, will come from the parathyroid gland that's in the back of the thyroid hormone, the thyroid gland. And your calcitriol or parathyroid hormone will actually cause the blood calcium levels to increase. So PTH, or parathyroid hormone, is secreted when your blood calcium levels are too low. And as a result, in order to increase your blood calcium level, it will go over to the bones and it will cause the bones to start increasing resorption. It will start the bones to start breaking down. And as they're breaking down, they're going to have to rely on osteoclast activity, the bone breaking cells. And as the bone is being broken down, the calcium is then released into the bloodstream, therefore increasing your blood calcium level. So just to reiterate, parathyroid hormone, aka calcitriol, will cause your blood calcium levels to increase. Your parafollicular cells will produce calcitonin, which will cause your blood calcium levels to decrease. So they are an antagonist. They work the opposite from each other. Here's a look at your parathyroid gland. If you can start off by taking a look at the illustration on the left, you're going to see the 4 little yellow glands. Those are the parathyroids embedded within your thyroid gland itself. And then come on over to the histology on the right-hand side, and you're going to see your parathyroid. Now, for those of us who are taking the lab, you will often have a slide that will have both the thyroid and the parathyroid on it together. And the way you're going to distinguish one region from the next is remind yourself that the thyroid gland will always have the follicles. So you're going to see those huge circles filled with couloid, surrounded by the parafollicular and follicular cells. Whereas if you look at the parathyroid, you're going to notice that the cells are all clustered together. There are no individual follicles, and that's because they're 2 separate glands. Alrighty, so now let's take a look at our adrenal gland. So a quick reminder, and this is correlating with our little question that's in the box. It says, which region of the adrenal gland does the adrenocorticotropic hormone, ACTH, target? So remember we talked about this. ACTH is produced by the anterior posterior gland. It is an example of a tropin hormone, and when it's released, it will go ahead and interact with the adrenal cortex. So please keep that in mind. ACTH will only interact with the adrenal cortex. And the cortex is an anatomical terminology that allows us to distinguish the outer layer of the gland, and the medulla will be the middle interior section. So go ahead and take a look at the picture. Remember, your adrenal gland sits on top of your kidneys, and you can go ahead and see the cortex section and the medulla section. And a little fun fact, they're actually from 2 different embryonic origins, so they will behave differently. But the cortex is the outer layer, and it's actually divided by different zonas, which we'll talk about. And then the medulla is the middle layer that has been indicated with the red and the blue blood vessels drawn in it as well. So ACTH will only stimulate the adrenal cortex. All right, so let's talk about what's happening with the medulla. The medulla is the inner core, and it turns out that it's actually composed of nervous tissue. So we have lots of what we call chromaffin cells that we find embedded within the medulla. Chromaffin cells are modified neurons. And what we see happening is when the adrenal medulla is stimulated, it will cause catecholamines to be released. And of those, you definitely want to know the most important one, which is going to be epinephrine, and also norepinephrine. But epinephrine is really the most important one. Anytime your body releases epinephrine, it's going to activate your sympathetic nervous system. So this is the one that gives you that feeling like you're all hyped up. You're going to notice that your heart rate starts to increase, your blood pressure rises, you feel your breathing rate getting sharper. So anytime you get hyped up and you get super excited, it's because your body gets rushed with epinephrine, and that is because of the adrenal medulla stimulation. We also see that it will help you with your alertness and to get your body ready for physical activity. And we know that the sympathetic system has an tendency to do that. It gets us all hyped up. So when we do this, what we see happening is as epinephrine and the other catecholamines rush through our bloodstream, it will go ahead and it will cause stimulation of glycolysis and gluconeogenesis. Now you're going to see those two terms quite a bit. So I added a little question and I said to you, hey, what's the difference? Well, both of them are going to allow us to increase our glucose levels, which are our simple sugar levels. This is the sugar we need to go ahead and generate ATP, our chemical energy. But it turns out that their starting point will be different. Glycolysis, which is the first one, has the term glycogen in it and lysis. Glycogen is a temporary storage unit of glucose, and lysis means to pull apart. So that just basically means you take your stored glycogen, your stored glucose, and you pull apart so that you can release the individual glucose molecules. Gluconeogenesis has the term genesis in it, and that means to create. Gluconeogenesis is going to create glucose from non-carbohydrate sources. So it's going to try to give your body sugar, but it's not going to rely on carbohydrates. Instead, it's going to rely on things like amino acids and your lipids to go ahead and generate glucose for you. So glycolysis means I'm just pulling apart my stored glucose. Gluconeogenesis means I'm producing glucose from non-carbohydrate sources, such as amino acids or from fatty acids and glycerol in lipids. We also see that as epinephrine is secreted throughout the body, it will actually temporarily inhibit your insulin secretion. And the reason it's doing that is so that we can go ahead and redirect the glucose to where it's needed most. And part of that is that the glucose needs to travel over to the brain so that you can think about your movement, you can think about your reaction. And this obviously will be a temporary effect before the glucose is redistributed throughout the rest of the body. All right, so if you get epinephrine from the medulla, then what's happening with the cortex? So we know that the cortex is going to be under control or under response from ACTH, courtesy of the anterior pituitary gland. And we know that the cortex is going to be the top section. So what exactly will it be secreting? And it turns out that the cortex is going to be secreting, in summary, it's going to be giving you cortisol, aldosterone, and it's going to give you a lot of your different androgens and sex steroids. So let's take a look at these different zonas. These are different sections that you find within the cortex. You have the zona glomerulosa, which is the top layer. For that one, we're going to think mineral corticoids. So it's going to help us with our electrolyte, our mineral balance. Then we have our zona vasculata. This one is a very thick layer. It's in the middle. This one is going to give us our glucocorticoids. And it's going to give us some androgens, some sex steroids. And then our zona reticularis is the bottom layer, and it will go ahead and do the same thing as the zona vasculata in giving us some glucocorticoids and sex steroids. Now, obviously, these are categories of hormones that will include a lot of different hormones. So what we'll do is, as we go over the slide, we're just going to emphasize the most important one as we're getting to know the endocrine system a little bit more. All right, so let's take a look at the individual zonas and let's figure out what do I need to know for my exam, right? Okay, so remember the top layer is going to be your zona glomerulosa, and I want you to know that the hormone that's associated with this layer is going to be aldosterone. This one is aldosterone, as a little side note, is the primary mineral corticoid that you have in your body. I just want you to know aldosterone is associated with the zona glomerulosa, and aldosterone will help you regulate your sodium and potassium level. So it's very important for your homeostasis because it will help regulate your sodium, Na, and your potassium, K levels. In our zona vasculata and zona reticulata, so the middle and the bottom layer, we'll see that both of those will release glucocorticoids. Glucocorticoids is a category of hormone secretions, and among those, the most popular one is cortisol. Cortisol is going to go ahead and make sure that we have enough glucose and energy surging through our body. So we're going to see that among our actions, and we're looking at our PowerPoint for this, we're going to see it's going to allow us to do fat and protein catabolism, so pulling it apart, doing gluconeogenesis, creating glucose sources, and providing our body with lots of glucose and fuel. So we usually see this also being released during stressful situations. The problem with cortisol, though, is that it does have an anti-inflammatory effect, which means that if you're exposed to high levels of cortisol for a long period of time, it can actually suppress your immune system, which can make it more likely for you to get sick. So one thing we see happening is people will always tell you, try not to stress too much. You're going to get yourself sick. You're going to get things like ulcers. And it turns out that those people actually know what they're talking about, because we see that high levels of cortisol will suppress our immune system. And we see that whenever we're exposed to high levels of stress, it makes it easier for opportunistic bacteria to come in, or viruses, and cause things like ulcers to pop up. So try to calm your mind and keep those cortisol levels nice and low. All right. Now, the last group of hormones that we have in our adrenal cortex will be our sex steroids, and these are once again being secreted by the zona vasculata and the zona reticularis. And what we see happening here is that these sex steroids will be helpful to both the males and the females, because they're going to give us small amounts of androgens, which is basically a version of testosterone, and estradiol, which is going to be a version of estrogen. Now, gentlemen, you will produce both testosterone and estrogen in the zona vasculata and zona reticularis. And yes, you need some estrogen. We see that it is important for your homeostasis, and it also does play a role in your sexual reproduction and enjoying your orgasm and sexual acts. We see that happening in our different studies. Ladies, we will also produce testosterone, and we will also produce our estrogen in our adrenal cortex. We also rely on testosterone for homeostasis, sexual development, sexual experiences. And more importantly, when we reach menopause and our ovaries shut down and they no longer produce estrogen, our body still needs that hormone. So that is then where the estrogen produced in our adrenal cortex will become extremely vital to the maintenance of our body system.